Welcome to the deep dive. Today we're tackling a very specific and common listener anxiety. Our mission is really to put on our critical thinking goggles and separate some facts from fear.
Exactly. We're looking at something called a hepatic hemangioma, or LH. It's basically a blood vessel tumor in the liver. And this all comes from a listener who has a small one, about 1.2 centimeters.
Right. And she's taking iron for anemia, and she's worried that the iron might, feed this tumor and make it grow.
That's the core of it, a very understandable fear.
It is. I mean, you're managing one stressful thing, the anemia, and then this other diagnosis pops up. Your mind just wants to connect them. So is there any real basis for this fear? Or is this just a classic case of mistaken identity?
Well, let's start with the facts. Let's just ground ourselves in what an LH actually is. It is the single most common benign tumor found in the liver.
Benign being the key word there.
Absolutely. And what's fascinating is the prevalence. It shows up in roughly 10% of the population, and it overwhelmingly affects women, usually around age 40, which really suggests that female hormones are a major factor.
Wait, 10%? 1 in 10 people. That's incredible. It really highlights how, this is usually not a big deal.
That's right. Most people are completely asymptomatic. It's almost always found by accident.
An incidental finding.
Exactly. During scans for completely different issues. And when we assess risk, it really all comes down to size. The vast majority are what's called the cavernous type, and they're just monitored.
Not treated.
Not treated, no. Only if they get very large, we're talking over 4 centimeters, or if they're positioned near the sensitive outer layer of the liver.
The Lissen's capsule.
That's the one. That can cause some discomfort, maybe some pain. But the risk of something like a rupture, that's extremely rare, and only with giant tumors, much bigger than 4 centimeters.
Okay, so size is everything, and our reader's tumor is 1.2 centimeters, so it's far, far below that risk threshold. Let's talk about the iron then. Her anemia is from blood loss, right? It has nothing to do with the tumor itself.
Correct. The two are unrelated conditions happening at the same time.
So why would anyone think a mineral supplement like iron could be a risk?
It's a question of biological context, and that's where the anxiety can creep in. So we have to be really rigorous here. We reviewed all the comprehensive medical literature from 2010, 2015, all the way up to 2022. And there's no documented statement, not one, no clinical trial that even suggests taking standard iron supplements makes a liver hemangioma grow. The data just does not support that connection.
So let me try to distill this. A hemangioma is a mass of blood vessels. Iron helps a body make functional blood cells. Are we saying that the mechanism for growth in the tumor is just fundamentally different? That iron isn't the right fuel for it?
That is the key distinction. That's a perfect way to put it. And we do have to separate a known risk from this myth. It is true that excessive iron intake can cause general liver toxicity. Iron overload is a real thing.
But that's a different problem.
A completely different mechanism. The toxicity impacts the main liver cells, the hepatocytes. The hemangioma, though, is structurally just a tangle of blood vessels. It's separate from that main liver tissue and doesn't seem to use that same biological pathway for growth at all.
That clarity is so important. So you're treating your anemia, not fueling your tumor.
Precisely. The core takeaway for you and for our listener is this. When you're dealing with a common, benign finding like a small LH, routine monitoring is really all that's needed. Trying to connect it to treatments for totally unrelated conditions like anemia is it's unsupported by the current medical evidence.
It seems like the anxiety around getting 2 diagnoses at once often outweighs the actual benign nature of the condition itself. It really makes you think, how often do you encounter health information that connects 2 unrelated things just because they happen at the same time? It shows how crucial it is to seek out that documented medical consensus, rather than trying to draw those lines yourself.